heard some screaming. I heard my husband yelling. It sounded like someone had gotten hurt. And saw Annalise on the deck, and she was blue. We just started doing CPR on her. She finally took a big breath, and it was just like a wheezing breath. Shortly thereafter, the ambulance showed up. From there, they took her into the ambulance. They decided that if she needed to come down to the medical center, to Memorial Hermann, and she would be life-flighted.
On arrival, she was not doing well. And so we immediately placed a breathing tube into her windpipe, and then we admitted her to our pediatric intensive care unit where our intensivist took over her care. And despite her arriving near comatose and in very bad shape, she actually did really well and was able to walk out of the hospital essentially neurologically intact.
I truly believe everything that happened, that series of events, if it had happened any other way, she might not be here.
That's why it's so important, right, for there to be readily available and immediate care that can provide life-saving interventions that can potentially turn some of these situations around. And while it is tragic that some of these near drowning happens, but prevent it from being the worst kind of tragedy, which is a funeral for a child.
When I walked out front, one of the deputies looked at me and she said, "Miss Gaston, you're having a stroke." So thankfully, they sent UT stroke unit to come and get me. And they got here like immediately. It seemed like a matter of seconds. They said that I had a clot that was moving, and they administered the TPA immediately. And that stopped, and says, "Okay, we're good now, but we're gonna take you to the hospital."
The national average for hitting the ED to the actual getting the medication is an hour. Our ambulance is attempting to eliminate that whole hour by treating the patients in the field.
Everything that I needed to save my life was right there, and they were able to administer what I needed.
For every minute that a patient's suffering from a stroke, they say 2 million brain cells are lost. So it's pretty significant, just the time savings. Ours was the first in the country. This unit right now can cover approximately 70% of the city. For our region to be able to treat the majority of stroke patients, we would need about 3 or 4 of them just in this region.
I gotta keep living. The unit helped me to be able to keep living.
My wife and I were fast asleep. I woke up having this incredible pain in my chest, like a knife in the center of my chest. And so I woke my wife up and said, "I think I'm having a heart attack." The EMS folks got me up, got me on the stretcher, got me downstairs and into the back of the vehicle, and asked me where did I want to go. And I said, "Hermann has a level 1 ER, take me to Memorial Hermann." The entire staff in the emergency room was waiting for me. They wheeled me in. I was immediately surrounded by emergency staff. I was in the cath lab in less than an hour, and I feel it saved my life.
That chain of survival, every chain of survival that we talk about starts from the second that a bystander witnesses an event. So whether it be a cardiac arrest or a traumatic event, it really starts with someone that's driving by or passing by. Without them, we have no knowledge of what's occurred, and so it starts from that initial 911 call, and then it travels through the EMS dispatcher, and then knowing exactly what to do, how to instruct the patient, and exactly the right resources to send to the scene.
And what we do in emergency medicine is that we try to develop systems of care, how effective that system is to save the most lives. That's our real challenge, and what I believe is our greatest opportunity.
I learned, and I think that it's worth noting, is speed is of the essence. When we're dealing with a crisis, whether it be a heart attack or any other trauma, speed by which you can get care is very, very critical.
There needs to be more. Whatever we gotta do here in Houston, we need to make it happen, because it's well worth it.
I know sometimes working in healthcare, there's a lot that happens every day in and out, and you don't always see what happens after. Know that she is here because of you, so we're thankful very much.
Thank you.
you.